Hello, esteemed viewers. Welcome to Medicine Focus. Medicine Focus, as always, is a channel here in YouTube that focuses on the different medications that are being used in the management of different disease conditions or treatment of different disease conditions, in which we are looking into the different classes of those medications, their examples, their mechanism of action, class they belong to, and others. So today, Medicine Focus brought you a particular very interesting topic, which is known as diabetes mellitus, in which we are going to focus on the medications that are being used in the management of this diabetes mellitus. But before we do that, let's quickly, there's need for us to look at what is diabetes mellitus in the first place. Diabetes mellitus is a very serious disease condition. Diabetes mellitus is a condition or pathological condition in which the pancreas is not able to produce or secrete insulin, or the insulin is produced but the body fails to utilize the insulin being produced by the body. So it's a situation insulin maybe not being produced by your pancreas, or it is being produced but your body fails to respond to the effect of this insulin, which leads to elevated blood glucose or blood sugar, which is being medically referred to as hyperglycemia. There are two types of this diabetes mellitus. Mainly, not only this, but mainly there are two types. Type 1 is referred to as autoimmune disease, in which your immune system attacks and destroys the insulin producing cells of your pancreas, which are known as the beta cells. And for type 2 diabetes mellitus, insulin is being produced in this case, not as of type 1. In type 2, insulin is produced, but the problem there is maybe it is not produced in sufficient quantity, or it is being produced, but your body failed to respond to the effect of this insulin being produced by the body. So this is what we should know about this going into this particular disease condition, diabetes mellitus. So there are two ways mainly that are being used in the management of this disease condition. For the type 1 is insulin replacement therapy. Insulin replacement therapy is being used for this type 1. And for type 2, oral anti-hyperglycemic agents are being used, or anti-hyperglycemic or anti-diabetic medication, whatever you call it, are being used in the management of this disease condition. So that's for type 1. There in this type 1, oral anti-hyperglycemic agents cannot work at all, because here in this case, as we said earlier, is autoimmune disease in which insulin is not produced totally as a result of the insulin producing cells in the pancreas, which are known as beta cells, being destroyed, attacked and destroyed by your own immune system, either due to viral infection, particularly Coxsackie virus is being found to be involved in this process. So for type 1, nothing can be done. For type 1 patients, nothing can be done rather than replacement of this insulin, which is not being produced by this pancreas. So there are different modes or ways of this insulin. We have the long acting, intermediate acting, we have the rapid acting insulins. And this insulin is being administered intradermally in between your muscles and your skin to replace the insulin which is not being produced by your body. So we have the long acting, as I said earlier, intermediate acting, and the fast acting insulins. Fast acting or rapid acting insulin start acting within short period of time after being administered and lasts for maybe 2 hours or so. Insulin aspart, insulin glucosamine are some of the examples of this fast-acting or rapid-acting insulin. We have the long-acting, such as insulin glargine, insulin degludec. We have the intermediate-acting, such as the isofen insulin, insulin zinc suspension. So let's quickly look into the main thing, which is the type 2 management of this diabetes mellitus. And like I said earlier, we are going to look at the different classes, their mechanism of action, and their examples, many more. And first on the list, we have the bigonides class. Bigonides are being found to work in the reducing of this elevated blood sugar. How do they work? They are being found to stimulate tissue uptake of glucose, particularly in muscles, and reduce gastrointestinal absorption of carbohydrate, and of which we all know carbohydrate is being found to carry along this particular glucose we are discussing about. Examples of this medication are the metformin, buformin, fenformin, and many others under this class. Another class is the sulfonylureas. This class of medications works by lowering blood pressure through increasing sensitivity to pancreatic beta cells, allowing more insulin to be released. It is also associated with increased tissue sensitivity to insulin, resulting in improved insulin action. And this particular class, the medication, the examples, we have the first generation of this medication and the second generation of this medication. The first generation include the tolbutamide, the chlorpropamide, and for the second generation, you have the glibenclamide, glipizide, glimepiride, and many others. Another class of these medications is the thiazolidinediones, also known as the glitazones, which are being found to enhance insulin sensitivity and promote glucose uptake and utilization in the peripheral tissue. They also suppresses gluconeogenesis in the liver and by increasing insulin sensitivity in adipose tissue. Examples, we have the pioglitazone, rosiglitazone, and many other examples. Another class is the alpha glucosidase inhibitors, which are being found to reduce carbohydrate digestion by interfering with the gastrointestinal glucosidase activity. Example, we have the acarbose, we have the voglibose, among others. Another class is the dipeptidyl peptidase 4 inhibitors, which is also known as the DPP4 inhibitors. These agents, they inhibit the DPP4, which is the dipeptidyl peptidase 4 enzymes, from increasing the concentration of incretins so that there will be no hypersecretion of insulin and promote glucose-dependent insulin secretion. Example of these medications is the allogliptin, sitagliptin, linagliptin, and many others. So there are many other classes of medications under this particular class, because one thing with medication is that I will know 101 or even 1001 medication, and there will be also more than 1001 medications that I wouldn't happen to know. So, but nevertheless, we will keep on investigating day to day to look at the newly improved, newly branded medications under different disease conditions. There are many disease conditions, many medications that are being used under the management of this diabetes mellitus. But Medicine Focus was able to come up with these ones, and if there are more updates pertaining these medications, definitely we will surely let you know. So, what do you think? What will be your reaction? Let's meet in the comment section. And if you want to get more of these videos, make sure you subscribe to this channel so that you can get to know more about different medications of disease conditions. Bye for now.